Tonight on Greater Boston, I'm Adam Reilly in for Jim Browdy. I'll talk to two local doctors among the hundreds across the country coming out in support of the Brigham and women's physicians targeted by neo-Nazis over their efforts to combat systemic racism in medicine. Then later, the executive producer and director of the upcoming film Fannie Lou Hamer's America join me on the life and legacy of the Mississippi civil rights leader. Early in the pandemic, then Boston Mayor Marty Walsh surprised some people when he declared racism a public health emergency. But the color of a person's skin has been a major predictor of health outcomes for decades, with Black and brown Americans facing higher rates of heart disease, strokes, cancer deaths, maternal and infant mortality, and considerably shorter life expectancies across the board. The medical profession used to attribute those disparities to inherent racial differences, but recently they've been linked to systemic racism in the healthcare system itself. That is a problem many physicians have been working to solve, including a pair of doctors at Brigham and Women's Hospital, Michelle Morse and Bram Wispelwey. But as we first talked about a couple of weeks ago, their efforts have been targeted by a local hate group ever since they published an article in Boston Review last April called An Anti-Racist Agenda for Medicine that outlined a program for addressing inequities in cardiology care at Brigham and Women's. In the months since, the Worcester-based group of neo-Nazis has been protesting Morse and Wispelwey, accusing the doctors of pushing a, quote, blatant anti-white genocidal policy. But after the group's latest demonstration, hundreds of doctors from around the country have shown their support for the anti-racist efforts, signing onto a letter, an open letter, written by the Massachusetts Coalition for Health Equity. That letter concludes, quote, the best response to neo-Nazi threats is exponential growth in programs like this one across the country. Two of those doctors join me now. Lara Jirmanus is a fellow at Harvard Center for Health and Human Rights and a clinical instructor at Harvard Medical School. And Tia Tucker is a physician at Cambridge Health Alliance. Thank you both for being here. Tia, let me start with you. If I understand correctly, and please tell me if I don't, a beginning or foundational tenet of anti-racist medicine is the fact that for decades, as we just said, the medical establishment has treated different groups of people in wildly disparate ways. Are there any examples from your own experience as a physician that point up that reality that you'd be willing to share?
Oh, absolutely. I think that this kind of stems from the growth of American medicine in the founding of this country in the 1800s and the 1900s. There was a lot of movement around eugenics, and also just during slavery. And there were a lot of people that proposed that Black bodies were different from white bodies, and they needed a lot of scientific work done to kind of back that up. And so that's kind of persisted over time. Some of the studies that we've done in order, especially I would say, give you some examples during COVID. We use a machine called a spirometer to try to evaluate how people's lungs are doing. There's actually a race calculation that is added to the spirometry results. It's based on an idea that some people's lungs based on race are different or have higher or lower capacity based on race. And this is a machine that we use in inpatient medicine as well as outpatient medicine in the clinic. Also, there is an underestimation of how much oxygen is in your blood based on that little thing that the doctors put on your finger. Yeah. It's called a pulse oximeter, and it's actually designed with certain skin tones in mind. It appears because it seems to underestimate the amount of oxygen that is in your blood if you are a darker skinned person.
Okay, thank you. Oh, go ahead. Sorry.
There's a long list you can stop. Yeah. There's many more things, unfortunately. GFR, which is it's a calculation that we use to measure how people's kidneys are functioning. It will help us decide whether your kidneys are failing or not. There's actually a race-based calculation on that.
And I think actually that's a perfect segue. I'm glad you brought that up. When I was reading up on this and looking specifically at what Mass General Brigham is doing, the initiative that's underway there to root out racism in medical practice. They mentioned, I believe, that they're adjusting that calculation, trying to remove that racial slant or that racist slant from the way kidney care is provided. But Lara Jirmanus, again, tell me if I have this wrong. It seems to me that a corollary tenet of anti-racist medicine is the idea that trying to go colorblind, trying to pull out things that are perhaps implicitly biased or that perpetuate racist ideas, that going colorblind or race blind has been attempted and has not succeeded. Am I getting that right?
Yes, absolutely. And this is the way that, our fields have worked under the assumption that the reason that people are experiencing these poor health outcomes is simply because of their underlying conditions, their higher likelihood to have other illnesses, or even perhaps the socioeconomic differences. I mean, we all know, and this is, I've been also working with a group called the Massachusetts Coalition for Health Equity, which has been pushing for an equitable response to the COVID pandemic. Understanding that one size fits all interventions and this kind of individual choice tack, which the governor has taken to address the pandemic, saying we're going to give you all the tools, is not sufficient to address the health inequities that exist in society. To put a massive vaccination center in Foxborough or in the suburbs, and to put up a website saying, you can sign up for vaccines here, it doesn't reach out to people who don't have access to computers, to internet. And so we really need to have focused interventions to target resources towards individuals and communities which have traditionally been marginalized. And that also is absolutely true in the hospital. There's a growing body of literature that's demonstrating the way that people of color have poorer health outcomes when they are admitted to the hospital. And when you control for all of their underlying risk factors, you ultimately, the only thing you can conclude is that the reason is racism, especially when you match that up with the studies that show that Black patients actually have better outcomes when they're treated by Black doctors. And so
go ahead.
and so what these interventions try to do is more like a bias prevention. We realize that there are certain people that our health system and not just our health system, but actually our our culture, which is because we live in a world which is founded upon colonialism, an economy which was based upon slavery. Those things stick with us. Racism is embedded in our culture. And so what we have to do is push back every single day and teach ourselves and our institutions to be anti-racist.
Let's get into some more details of what that actually entails. Tia, in that Wispaway and Moore piece in Boston Review, they advocate what they call a healing arc model. They'd like to see Brigham and Women's use it to address inequities in cardiology care, and they'd like to see other institutions perhaps replicate it. In that acronym, A stands for acknowledgement, R stands for redress, C stands for closure. Can you offer a brief summary of what each of those terms means in this context?
Sure, and I'll give you an example. What we're doing is we're trying to use scientific evidence to evaluate what actually is the cause. And Lara mentioned earlier, it's racism. It's really important to point out to people that it's racism and not race. There's not a biological construct of race. This is all sociological. So when we're looking at acknowledging what that means using the evidence that we have through research, scientific research, to objectively identify what the real issue is structurally. And then when we're talking about redressing, we're confronting the issue. We're trying to figure out what kinds of interventions can we design to try to make that happen. I think that they did a really good job of enumerating that specific response that's needed. And I think people, instead of feeling like, this feels dangerous, and it's actually, like Lara said, it's a bias prevention. We're looking at different ways where this has been acted on, where racism has affected patient care, and confronting that and making things equitable.
Correct? C is speaking with the communities that have received inequitable care in the past and saying, have we made you whole in our efforts to address this problem? Am I getting that right?
Absolutely. And it's really important that people the things that we've done wrong in the past, I think, as far as medicine is concerned, we haven't gone into the communities and gotten that closure. We haven't said, hold us accountable. Have we done our job? There's been a lot of kind of patriarchal top-down approaches to medicine. And this is more with a community focus in order to make sure that we're doing the right thing and hold ourselves, again, accountable to what we're doing as physicians.
Lara, I think both you and Tia have used the phrase bias prevention here, but I want to ask you about specifically the intervention that Wispaway and Moore proposed at Brigham and Women's. They suggest what they call, and this is their phrase, a preferential admission option for Black and Latinx heart failure patients who in the past studies have shown were not admitted to cardiology care, specialized care with better outcomes at the same rate as white patients. So they call for a preferential admission option for Black and Latinx heart failure patients. And we have a fuller description of how they would like to see that implemented. Let's pull that up and we can take a look at it for viewers. The healing arc will include a flag in our electronic medical record and admission system suggesting that providers admit Black and Latinx heart failure patients to cardiology rather than rely on provider discretion or patient self-advocacy to determine whether they should go to cardiology or general medicine. Lara, is it fair to say that this is probably the source of some of the pushback that we've seen from the political right when it comes to anti-racist medicine? The idea that Black and Latinx patients might now have a better chance of getting a somewhat scarce medical resource than white patients who traditionally enjoyed superior access to that same resource?
I cannot read their minds, but what I can say is that these kinds of systems are in place very much already within the medical record to remind us to order a test, a particular kind of test for a patient who has diabetes, to suggest that we double check when a patient is uninsured, to offer us the option to send their medications to a pharmacy which is more likely to cover it. And so what this is again trying to do is prevent bias, because it knows, and we know, looking at our own data, that we as physicians are more likely to admit white patients to a cardiology service than Black patients or than other people of color. And so what this measure is trying to do, and it is very data driven, I will say. So the whole point is that you look at the data and you say, are we achieving equity? Right now, we're not. And so what we are actually trying to do is level the playing field, is giving people a fighting chance. And these are really high stakes. In some cases, when people are high risk, they actually have better outcomes when they're admitted to a cardiology service.
And just to piggyback off of that,
please.
You said something really important, Alan, that I think needs to be restated. You mentioned that they're concerned about superior access, and that's exactly what we're worried about. It's people that are interested in practicing health equity. We're looking at our healthcare through a lens that means that anyone, regardless of their race, their sex, their gender, how much they can afford, is deserving of healthcare, is deserving of access to improved health outcomes. So that this idea that there's a scarcity mindset, whereas we're going to offer preferential treatment to another group of people, it's actually we're offering the same treatment. We're offering people access, which they did not have before.
Let me ask you about that. Is it the same access being offered, or is it heightened access being offered? To use the phrase of Wistful Way and more a preferential admission option, heightened access in the name of achieving equity that has not existed before, where there has been inequity in the past?
No, it's about achieving, I think that the objective is equity. It's
right.
about achieving equitable levels of access with regard to people's underlying risk factors and medical necessity. And that is something that our programmed brains, because we live in a society that repeatedly teaches us to be racist every minute of our lives, we have to insert reminders saying, hey, wait a second, the white, very rich looking patient that keeps telling you he really wants to be admitted to the cardiology service, well, that's not a medical reason to admit him. And that is the kind of thing that these systems are trying to counteract. I'll say reparations is another piece of this, and that is about kind of financial compensation, but nobody is advocating for, for making up for decades of inequitable treatment by denying people access to healthcare that they need based on their skin color. It's actually quite the opposite. It's trying to figure out, how do we actually get our system to remind us to push back against our racist underlying ideas and make sure that we're actually offering the same opportunity for life-saving healthcare to everybody.
I've already gone over the amount of time that I had budgeted myself to have this conversation, but it's so big and so important. I want to just take another minute or two. If you could answer these questions, they're big questions, but a brisk answer would be great. I want to make sure you get a chance to take them on. Tia, how open do you think your fellow physicians are going to be to this approach? There's obviously plenty of people who signed that letter in support of Wistful Way and more, but I know there's skepticism in some other quarters. How open is the medical establishment as a whole to this approach?
Sure. I think it depends, of course, but this is something that is gaining a lot of traction in medicine, and not this approach that they've designed is unique, and it's hardy, it's comprehensive and evidence-based, but there's a lot of things that physicians are already doing that are not exactly this approach with their health equity accelerator. They are applying educational models to go out into communities and meet people where they are in spaces where they did not have access to education. Lara mentioned earlier about vaccine access. There's been a lot of programs that have gone directly to communities that have in the past suffered from access to vaccines and miseducation, and have gone directly to those communities. We've done a lot of work here on making sure that we're confronting policies that have disproportionately affected people of color in our hospitals. So this is something that I see people doing everywhere. It might not be the same value as this really comprehensive, very powerful health equity accelerator. But yes, physicians are interested in promoting health equity. They took an oath to do no harm. They realize that racism is doing people harm, it's killing people, and they're focused on how to change that.
Lara Jirmanus, last question for you. I know you're not a legal expert, you're a physician, but just briefly, are you concerned if this approach continues getting legs, as Tia just described? Are you concerned about the courts fighting against it, prohibiting it, given the composition of the judiciary in the country right now?
I think that because of the space that we are working in right now, and because of our objectives and our evidence base that demonstrates, even the Institute of Medicine concluded, I believe it was about 8 years ago or so, in a paper, that colorblind approaches do not work to address health inequities. I think that we stand on solid ground.
Okay. Lara Jirmanus and Tia Tucker, thank you both for helping to untangle this. Appreciate it.
Thank you.
Civil rights leader Fannie Lou Hamer is often remembered for this famous speech at the 1964 Democratic National Convention.
Is this America, the land of the free and the home of the brave, where we have to sleep with our telephones off of the hook because our lives be threatened daily, because we want to live as decent human beings in America?
Hamer used that moment to call for delegates from her Mississippi Freedom Democratic Party to be seated at the convention rather than the state's all-white Democratic Party delegation. And although that effort proved unsuccessful, she brought greater national attention to the oppression of Black Americans in the South. That DNC speech was one of Hamer's best-known public moments in a life that spanned from a hardscrabble childhood in the Mississippi Delta to a midlife ascension as a well-known activist and leader to an untimely death at age 59 from breast cancer in an all-Black hospital. A new documentary coming next week to PBS and the World Channel called Fannie Lou Hamer's America tells the full story of Hamer's life through speeches, interviews, and song. It's co-produced by Hamer's great niece, investigative reporter Monica Land. She joins me now along with the film's director and editor, Joy Davenport. Thank you both for being here. Monica, let me start with you. In the documentary, your great aunt says that she was, if I have my math right, about 45 years old when she discovered that Black Americans could actually register to vote and vote. What changed in her life and in the culture at large when she had that epiphany, or paved the way for that epiphany?
I think it was just circumstance, and Joy can definitely speak to that better than I can.
Okay.
But growing up as a sharecropper, her life was definitely oppressive. And I think anyone in that situation would obviously want to do better. And so she tells the story that she heard there was a mass meeting at a local church, William Chapel. She asked my uncle, could she attend? There was some kind of bargain. If she picked so much cotton or something or another, that he would take her. She did exactly that, and she attended. And so it was revelational that she could have a voice in how she was living her life. And from that moment on, she chose to do exactly that, not only for herself, but for every other Black person in Mississippi. I think, and eventually the nation, but particularly Mississippi, where they were so oppressed, where there was so much poverty and disadvantage. And so wanting to make that known throughout the state.
And I think the film does drive home, both with older footage, there's a lot of fascinating very evocative and at times tough to watch. Older footage and newer footage, which is also depressing because it suggests not a ton of progress has been made, that drives home the reality of that material impoverishment that you're talking about, which obviously has profound consequences that go beyond the material. Joy Davenport, I want to ask you, one of the things that struck me about this film is that there is no omniscient voice of God narrator. The dominant voice in the film is Fannie Lou Hamer's itself, sometimes in isolation, sometimes in conjunction with other people. Why did you make that call?
She is the voice of God. I mean, she is the voice that we need to hear. I feel like for a voice as powerful and unique and resonant as hers, it should be the only one telling us about her. I think that's both an ethical decision and a creative decision that leads to it having more power to get across what it is she was trying to get across. Because the film is structured like one of her speeches. Her speeches were one of the primary sources we had to go to document her life. And we didn't want to have talking head historians or a voice of God narrator to get between us and her. We wanted to get as close as possible to her.
And as you say, and I don't have the sonic knowledge to describe this, but simply on an audio level, there is so much contained in her voice, and there's such a depth of feeling in there that it really creates, I think, a different sensation as you're watching it. Monica, can you describe for me briefly what happened? And I say briefly, it's such a horrific event, sustained event, but it seems to me incredibly important in her life. What happened to Fannie Lou Hamer in Winona, Mississippi, and how did it shape her life moving forward?
Well, they were returning from a voter registration workshop. They stopped to use the restaurant, to use the restroom facilities. And one of the often misconceptions that we hear is that Aunt Fannie Lou also went into the restaurant, and that is incorrect. She actually stayed on the bus.
Which we hear her say in the film.
When they went into this restaurant, exactly. But it has been printed or continued to be repeated that she was in the restaurant and she was not. And so it was a segregated facility. And so when she saw her colleagues rush out, she, of course, naturally stepped off to see what was the problem. And one of her colleagues told her to get back on the bus. And as she did that, of course, she was taken into custody. One of the law enforcement officials said, "Get that one there." And so they arrested her, put her in the car. She tells the story, and she was arrested. And it was, I'm positive that I can say, as it would be for anyone, particularly a 44 or 45-year-old woman, to be beaten with such force. It was traumatic. It was an experience that she never forgot. It had long-lasting emotional, mental, and physical ramifications. And so, but she was able to use that. A great deal of her testimony at the Democratic National Convention was spent talking about that very experience. And I may note, I don't know if it was added in the final cut or not, that there were charges brought. There was a trial, but there was an all-white jury, and no one was held accountable for that situation. They beat several people, including a 15-year-old girl, and no one was held accountable for it. And so something like that, you think about today, the aggression we see with people with Black Lives Matter when police are found or acquitted because of a particular crime, the rage that it evokes from the public. And Fannie Lou had to deal with that, and she used it throughout her career.
It's an almost, when you get into the details of it, I found myself wondering how she lived. I mean, how she was physically able to survive and then to move on from it. But she did move on. As you said, she bore witness in this incredibly powerful way in a number of settings. She ran for Congress. She was active in trying to shake up the Democratic Party, providing an alternative to the existing racist structure. At the end, or toward the end of her civil rights activism, there's a moment that's highlighted in the film that points to a bigger dynamic when Roy Wilkins, the very well-known civil rights leader, speaks to her dismissively, basically says, "You're not what we're looking for in the movement anymore, and it's time for you to bow out." Joy Davenport, can you explain why someone like Roy Wilkins would have been so dismissive of Hamer?
So this is something that continues today. This isn't unique to the historical moment, but there was a kind of respectability politics in play where she wasn't the face of the movement that they wanted to promote. They called her uneducated. They said that she didn't understand. She was ignorant of how things really were. And they wanted to get her out of the spotlight because the thing is, once she starts speaking, it's hard not to listen. And they found that she was getting attention that they wanted to be directing towards other things. And it was disruptive of the plans of the institutionalists like Roy Wilkins, for her to come with her Mississippi Freedom Democratic Party and say, hold on now, none of this is right. Like, we got to just start from the ground floor if we're going to get this right. And that's not how the institutionalists of the time were trying to promote the movement. So she was in many ways beset from all sides because the people who she was working with in some ways didn't support her, and the people she was working against definitely did not support her.
I should have mentioned at the outset that her speech at the DNC was so threatening to various people that, if I recall correctly, President Lyndon Baines Johnson preempted it, held a speech of his own to distract from this address that she was giving. Am I getting that right?
Yeah, well, he kind of Streisand affected it. Correct. Because originally, she was giving her speech and people were watching it and he didn't like that. So he called a primetime address to announce like today's Thursday or whatever. And because of that, the other networks were like, well, we need to show the whole speech. And so it ended up getting more attention because he got spooked by her.
Monica Land, we only have a few seconds left, but as her descendant, her relative, what do you think the lesson of Fannie Lou Hamer's life is for people today and, as you said, for activists today?
Resilience. You know, I love the fact that she was a common person. And I think that's what made her so effective and so popular. People often can't relate to someone that does not have shared experiences. And so because she came from, the cotton field, was a sharecropper, her life was a life of poverty. And so she could relate to people like no one else of that stature could. And so likewise today, I think people are looking for a voice that's familiar to their own a circumstance. And so I think that's why her legacy continues to resonate. Every time it seems you see a Black Lives Matter protest or something, someone has a sign or a shirt that has one of her quotes. Nobody's free until everybody's free. I'm sick and tired of being sick and tired.
I was actually amazed watching the film.
And that speaks to the relevance.
I'm sorry I interrupted. I was going to say, watching the film, I was amazed at how many phrases were familiar that I didn't know came from her. So we have to leave it there. Monica Land and Joy Davenport, thank you both. It's a fascinating film.
Thank you so much.
Thank you.
Fannie Lou Hamer's America airs on GBH2 on February 22nd at 9 p.m. and on the World Channel on February 24th at 8 p.m. Also, tomorrow at 3, there will be a Zoom panel discussion with the filmmakers. You can register online at FannieLouHamersAmerica.com. That's it for tonight, but do come back tomorrow for a look at the new Frontline film, American Reckoning. Thanks for watching.